Epilepsy Management Plans. Trigger warning. Content may be too much for viewer. Watch at your own risk. Now, what is epilepsy? Epilepsy is a neurological disorder in which brain activity becomes abnormal, causing seizures or periods of unusual behavior, sensations, and sometimes loss of awareness. The difference between seizure and epilepsy is that a seizure is a single occurrence, whereas epilepsy is a neurological condition characterized by 2 or more unprovoked seizures. The seizure symptoms vary depending on the type of seizure. In most cases, a person with epilepsy will tend to have the same type of seizure each time, so the symptoms will be similar from episode to episode. These are the signs and symptoms of epilepsy. First, we have temporary confusion. Next, we have staring, or what we call absent seizure sometimes. Stiff muscles, uncontrollable jerking movements of the arms and legs, loss of consciousness or awareness, and lastly, psychological symptoms such as fear, anxiety, or déjà vu. Now, the nursing management of epilepsy. The nurse should continually give reassurance that the seizure will stop and that the patient will not be left alone. Second, the nurse should protect the patient's head from banging on the floor while the convulsive movements are occurring and loose any tight clothing. Next, the nurse should try to turn the patient into the recovery position. And lastly, the nurse do not force anything into the patient's mouth, as this could damage teeth and gums.